Medicare Management Services. The Centers for Medicare and Medicaid Services, CMS, recognizes chronic care management, CCM, as a critical component of primary care that contributes to better health and care for individuals. In 2015, Medicare began paying separately under the Medicare Physician Fee Schedule, PFS, for CCM services furnished to Medicare patients with multiple chronic conditions. This booklet provides background on payable CCM service codes, identifies eligible practitioners and patients, and details the Medicare PFS billing requirements. Beginning January 1, 2019, the CCM codes are CCM, the first code is CPT 99490, Chronic Care Management Services. At least 20 minutes of clinical staff time directed by a physician or other qualified healthcare professional per calendar month, with the following required elements. Multiple, 2 or more, chronic conditions expected to last at least 12 months, or until the death of the patient. Chronic conditions place the patient at significant risk of death, acute exacerbation, decompensation, or functional decline. Comprehensive care plan established, implemented, revised, or monitored. Assumes 15 minutes of work by the billing practitioner per month. The next CPT code is CPT 99491. Chronic care management services provided personally by a physician or other qualified healthcare professional. At least 30 minutes of physician or other qualified healthcare professional time per calendar month with the following required elements. Multiple, 2 or more chronic conditions expected to last at least 12 months, or until the death of the patient. Chronic conditions place the patient at significant risk of death, acute exacerbation, decompensation, or functional decline. Comprehensive care plan established, implemented, revised, or monitored. And next we move on to the complex CCM, which is CPT 99487. Complex chronic care management services with the following required elements. Multiple, 2 or more, chronic conditions expected to last at least 12 months, or until the death of the patient. Chronic conditions place the patient at significant risk of death, acute exacerbation, decompensation, or functional decline. Establishment or substantial revision of a comprehensive care plan. Moderate or high complexity medical decision-making. 60 minutes of clinical staff time directed by a physician or other qualified healthcare professional per calendar month. Okay, the next CPT code is 99489. Each additional 30 minutes of clinical staff time directed by a physician or other qualified healthcare professional per calendar month, lists separately in addition to code for primary procedure. Complex CCM services of less than 60 minutes in duration in a calendar month are not reported separately. Report 99489 in conjunction with 99487. Do not report 99489 for care management service of less than 30 minutes additional to the first 60 minutes of complex CCM services during a calendar month. CCM, sometimes referred to as non-complex CCM and complex CCM services, share a common set of service elements. They differ in the amount of clinical staff service time provided, the involvement and work of the billing practitioner, and the extent of the care planning performed. Practitioner eligibility. Physicians and the following non-physician practitioners may bill CCM services. certified nurse midwives, clinical nurse specialists, nurse practitioners, physician assistants. Note that CCM may be billed most frequently by primary care practitioners, although in certain circumstances specialty practitioners may provide and bill for CCM. The CCM service is not within the scope of practice of limited licensed physicians and practitioners such as clinical psychologists, podiatrists, or dentists. Although practitioners may refer or consult with such physicians and practitioners to coordinate and manage care. CPT code 99491 includes only time that is spent personally by the billing practitioner. Clinical staff time is not counted toward the required time threshold for reporting this code. CPT codes 99487, 99489, and 99490, time spent directly by the billing practitioner or clinical staff counts toward the threshold of clinical staff time required to be spent during a given month. CCM services that are not provided personally by the billing practitioner are provided by clinical staff under the direction of the billing practitioner on an incident-to basis as an integral part of services provided by the billing practitioner, subject to applicable state law, licensure, and scope of practice. The clinical staff are either employees or working under contract to the billing practitioner, whom Medicare directly pays for CCM. Note that only one practitioner may be paid for CCM services for a given calendar month. This practitioner must only report either complex or non-complex CCM for a given patient for the month, not both. Supervision. The CCM codes describing clinical staff activities, the 99487, 489, and 490, are assigned general supervision under the Medicare PFS, pay fee service. General supervision means that when the service is not personally performed by the billing practitioner, it is performed under his or her overall direction and control, although his or her physical presence is not required. Patient eligibility. Patients with multiple, 2 or more chronic conditions expected to last at least 12 months or until the death of the patient, and that place the patient at significant risk of death, acute exacerbation, decompensation, or functional decline, are eligible for CCM services. Billing practitioners may consider identifying patients who require CCM services using criteria suggested in CPT guidance, such as the number of illnesses, the number of medications, or repeat admissions or emergency department visits, or the profile of typical patients in the CPT prefatory language. There is a need to reduce geographic and racial ethnic disparities in health through provision of CCM services. Table 2 provides a number of resources for identifying and engaging subpopulations to help reduce these disparities. The billing practitioner cannot report both complex and regular, non-complex CCM for a given patient for a given calendar month. In other words, a given patient receives either complex or non-complex CCM during a given service period, but not both. Do not report 99491 in the same calendar month as 99487, 89, or 90. Examples of chronic conditions include, but are not limited to, the following: Alzheimer's disease and related dementia, arthritis, osteoarthritis and rheumatoid, asthma, atrial fibrillation, autism spectrum disorders, cancer, cardiovascular disease, chronic obstructive pulmonary disease, depression, diabetes, hypertension, infectious diseases such as HIV/AIDS. Initiating the visit. For new patients or patients not seen within 1 year prior to the commencement of CCM, Medicare requires initiation of CCM services during a face-to-face visit with the billing practitioner, an annual wellness visit, AWV, or initial preventative physical examination, IPPE, or other face-to-face visit with the billing practitioner. This initiating visit is not part of the CCM service and is separately billed. Practitioners who furnish a CCM initiating visit and personally perform extensive assessment and CCM care planning outside of the usual effort described by the initiating visit code may also bill HCPCS code G0506, comprehensive assessment of and care planning by the physician or other qualified healthcare professional for patients requiring chronic care management services, billed separately from monthly care management services. Add-on code lists separately in addition to primary service. G0506 is reportable once per CCM billing practitioner in conjunction with CCM initiation. Patient consent.